How you
Hello.
doing? How are
I'm
you?
so very well.
How was
There we
your
go.
long weekend?
It was very relaxing. I did some hiking and a lot of hiking, and apparently I ran through a spray pad too.
Oh, I did. I saw that. Thank you for getting that open. You and the power of all the mayors. So thank you very much. I'm sure a lot of
Mm.
parents were happy about that. So
You
a lot of
wouldn't believe what kind of magnet for children it was as well. So we
sure.
were testing it. We went down to test it to make sure we could get them open, and it needed a new cap, but they were testing the pipes. And no sooner did we turn it on to test it, like suddenly, dozens of kids appeared, and they were
Oh,
having so much
did
fun,
you get,
almost as much fun as I was having.
did you get soaked? So okay, let's start. I need a new computer. I need a new TV. When are the non-essential aisles going to be open?
Yeah. Oh gosh. Okay. That's a good
Sorry,
question. So
sorry. I'm starting.
retail. No. Hang on. That's a good question. Oh, so I think non-essential retail is the 14th at 15%. So it should open
Okay.
on the 14th, right? At 15%. And then when we get into phase two, step two, what they're calling that now, then it goes up to 25% for non-essential retail. And then it goes up to 50. I printed the chart up,
Okay.
printed the
So
chart for you. Yeah, and then it opens up after that. And of
okay.
course, so the criteria is basic. Well, the main criteria is vaccination percentages of our population. However, we also know it has a lot to do with the conditions in our hospitals.
Yeah.
And I'll warn you, so we are more than 60% vaccinated with one dose. I think our numbers are 850,000 vaccinated 18 plus. Well, it would be 12 plus because it's open at 12.
Yeah.
With one dose, and about 33,000 with dose two, which are frontline healthcare workers. So we've exceeded that indices, but where we haven't is the hospitals, because basically you want them to start reopening for electric surgeries, and we're not at that point yet. To open for elective surgeries, you have to be able to, let's see if I get this right, not being transferring patients out, which we continue to do at a rate of 30 or so per day,
Yeah.
but accept patients transfers, and have a capacity in the event, be able to expand your ICU. Those were the two criteria. So accepting other patients from other hospitals into your ICU. So we're not at that stage. So we're not looking at opening or opening up elective surgeries yet. So we have met the vaccination threshold for
Yeah.
the June 14th opening, which is, of course, outdoor gatherings to 10 people, outdoor dining 4 people per table, essential retail capacity at 25%, non-essential 15%, outdoor religious services, etc. Outdoor sports, including training and personal training for up to 10 people, day camps, campsites,
That's
etc.
June 14th.
That's June 14th. So we've met that. On the call today, there were some mayors asking that be put forward. I have to be honest, things are so tenuous, so fragile. That's the way to describe it. Because we had great numbers today. I'm going to go through that with you in a second. But that could change in a dime. And I think what everyone's worried about is what happens in 10 to 14 days after this long weekend, where we have evidence people were gathering, even if it's to watch fireworks. So,
So
will the numbers take a little jump again? Will they bump up again? So I don't know what they're calling it. I'm calling it step 1, 2, 3. So step 2, you have to have 70% vaccinated. By the way, we're almost there. We're about there. We're 68, 69, 70%, right?
okay.
Vaccines. But there again, what condition will the hospitals be in? And that's open indoors with small numbers and face coverings, and expand outdoors. So then it's large outdoor gatherings to 25 people. This is in step 2, phase 2, whatever they're calling
Yeah.
it. Small indoor gatherings for up to 5 people. Outdoor dining for 6. Essential retail at 50% and non-essential for 25%. And the big one, ready? Personal care providers.
So that's 2, right?
What do you
That's
mean
2.
2? What do
That's
you mean
step 2.
2? That's
Step
step
2.
2. That's
Yeah.
step 2. So I can finally get my hair done. Step
Your
2. Well, yeah,
hairstyle looks pretty good.
yeah, but my daughter does it,
Yeah. Yeah.
and now she's moved out, so I don't know if she's going
Oh,
to
she moved
continue to
out.
do it
Uh-oh.
for. Yeah, right. So now she's not going to do it for me anymore. And then step 3 is 70 to 80% vaccinated. So we'll probably hit that in June or July. pending the flow of vaccine, right? Vaccine availability has now been a holdup. So we got 50% of all the vaccine allocation for 2 weeks. Hence, we were able to get our numbers up. But now, like cities like Hamilton are trailing because he said, well, we're not at 60, we're maybe over 50%. So they're considerably behind. But he said, well, because Peel and Toronto, rightly so, I'm not going to argue, got the vaccine because we have to deal with the hot spots and the inferno. But at phase 3, we have large indoor and outdoor gatherings, indoor dining, and essential and non-essential to open with limited capacities, larger indoor religious services, indoor meeting and event spaces. So that sounds really good, but I think they had that in mind for September.
Yeah.
I think it was basically June 14th, and they said 3 weeks. So sometime mid-July or early August to go to phase step 2, whatever it is, and then September, that phase 3. I think that's what they had in mind, but I'm speculating because, of course, we asked for clear guidelines and a clear criteria, and we did get a plan, and I'm very grateful that we now know what they're thinking. But, you know, I think the timelines will depend on what the situation is, right?
So, Mayor Crombie, you're saying a lot right now. So let's break it down. So June 2nd, the stay-at-home order is done. Okay, so June 14th is the potential date of step 1.
Correct.
What happens in this purgatory between June 2nd and June 14th? Is this like a gray zone?
So it's the gray zone, I suppose. It's a good question. It's a 2-week period where you can move from home, not a stay-home lockdown order, but things don't really reopen yet.
Okay, so is there a chance that the June 14th step 1 can be moved up? Because you said that
this was the conversation on the call today with the GTHA mayors, and I'll be honest that most of the mayors were reluctant to support it, just because, as I said, it's a very fragile environment right now. It's very fragile. And, you know, I'm very concerned what's going to happen in 10 to 14 days, given we just came off a long weekend and how many people gathered and saw friends and extended family members. And we'll see the evidence in 10 to 14 days. Now, things look good because, of course, we have almost, 70% of our people vaccinated. Now, dose 1 reduces the likelihood of death and reduces the severity should you get COVID, right? Reduces hospitalization. Not until you get your second dose does it eliminate the spread of the virus. No, eliminates a strong word. Reduce the spread of the virus significantly, right? So those are the indices. So, they're saying that with dose 1, you might still get the virus, but it won't be as severe an impact on you, and you probably won't die as a result because you've had the first vaccination. But not until you get the second one, there's a bigger comfort level.
Okay. So August dine-in, that is a possibility.
August, September.
August, September, okay.
But so we'll have a lot of outdoor patios over the summer, right?
Yep.
But so can we talk numbers?
Yeah, so let me ask about, because I think we're talking about May 24, it just happened, right? And I'm assuming the tickets that you handed out would have a lot to do with whether or not people were listening over the weekend.
Yeah, I have those numbers. Let's do the tickets then. So we had, where did I see? In terms of, we had 22 charges over the weekend. And Friday, they were car meetups, those car rallies.
Yep.
Gatherings at private residences. Saturday, there was another car meetup. Saturday and Sunday, there were private residence gatherings. Gatherings in parks. Gatherings Monday at a private residence. And there were, and then the security highlights. So these are the people who were educated but didn't get a ticket. And there were 22 total incidents, approximately 424. Just over 400 people that were educated and informed. Okay. And a lot of them took place at parks where too many people gathered to play sports, because I think people got excited. They could play recreational sports outside. And I think just too many went out to play. Looks from the basketball, exercise class, basketball, soccer, etc. Cricket, large group gathered, different parks, large groups gathering. And then Sunday, cricket, soccer, fireworks, people gathered to set off fireworks. And then Monday as well, same, like large groups gathering. And some of those large group gatherings would have been fireworks without a permit and gathering to watch them.
Mayor Crombie, is this more than usual than an average weekend?
This is getting better. There are only 22 fines.
Okay,
Right?
so that's a good sign. That's a good sign.
Cumulatively, we've only had 1,079, right?
Okay, all right.
No. Well, yes, 1,079. Public complaints 10,000, but we investigate and charge sometimes. Obviously, only 1% of the time.
Okay, so let's talk about
10%. Sorry, 10%.
And do you have the COVID numbers handy in regards to?
I do. I'm very pleased. I'm very pleased because today, I'll just talk about the increases today. We had a very good day. Mississauga had only 143 cases.
Well, that's probably the lowest it's been in like 2-3 months.
Since March 15th, I checked.
Wow, okay.
But Brampton was 213, but still that's pretty good. And then yesterday, oh, wait a minute, that was yesterday. Today was better. Sorry about that. That was Sunday. Why don't I give you Saturday and then give you Monday? Saturday was around the same range, 150 in Mississauga, 214 in Brampton. So not bad, but today, well, yesterday, sorry, today's numbers, Monday's numbers, 84 cases.
Wow, okay, that's really
good. Pretty good. Yeah, that's the one where I checked. It was only March 15th. In Brampton, 158. So I'm just keeping my fingers crossed that they don't say, oh, yeah, yesterday was a blip. All the numbers weren't reported in, and tomorrow was higher to compensate.
True.
That has happened to us before as well. Okay, but on the rolling averages, because I got the EPI report too for you. I always get those printed. I have them come in early on Tuesdays now just for you. So the number in Peel is 177 cases per 100,000. Ours in Mississauga is 147.
Okay.
And if we have any more days like today, they will go down significantly. Brampton's is 283, so they're coming down. Remember, they were 450 3 weeks ago. Khaled in 118. So that's very good. But what the good news is the positivity rates are also stabilizing. Brampton, Mississauga is a bit high. Brampton's 12.7. That's a bit high. Mississauga's 10.4. A little bit high. Khaled is kind of where you want to be right now, 7.9. You want to get under 7%. That's positivity rates. And then the R factor, I'm very pleased that the reproductive rate is under 1. Not significantly under 1, but it is. Ours is 0.88. But Caledon's 0.83, and Brampton's leading us this time. They're at 0.78. So that's very good news. I'm still not showing any of the variant of concern that originated in India. I'm just showing largely variant B117, which is the UK. 1351 is the one. We have very little of that, and that is the South African. And there are a few P1s, not many. That is the Brazilian, sorry. Brazilian. I'm not showing the Indian variant here, although I know it's present in Ontario, but I'm not showing it on our numbers yet, and which is good news. But we did have breaking news, one reported death from the VITT today, and was a man, I think in his 40s, and that's just breaking, so we don't know anything more about it or where they're from or who they are yet. Well, at least I don't.
Yeah. Okay. The vaccinations, do you have the vaccination numbers? How many people have been vaccinated? That's the positive number.
850,000 in Peel, 12 plus, and that's a first dose, 33,000 with second dose. So those are very good numbers. And of course, everyone is eligible now to go register for your second dose of AstraZeneca. I think largely what I've been hearing is the pharmacies are reaching out to those people that they vaccinated in the order in which they vaccinated them and inviting them back for their second dose. And we know that the benefits of every one of those vaccines, including AstraZeneca, far outweigh the costs, right? The benefits far outweigh whatever difficulties. There have been like a handful of incidents with symptoms, side effects for any of the vaccines. And we know that to be true with vaccinations. There's always a very small percentage that react.
True. I guess who can get vaccinated right now, just so there's no confusion.
Oh, I'm so glad I looked down on my phone. I'm so glad, because they've just updated. Mayor, they've just updated the numbers, your numbers from before the weekend. We've hit 1 million doses.
Oh, really? Peel or Mississauga? Oh, I guess it would be Peel, sorry.
Peel.
Yeah,
It's Peel. I
we
can't
don't have
even track.
million.
Yeah. Region just announced it on Twitter. We've just hit 1 million doses.
Nice. Okay. So
Well, considering we're 1.5 million people, that's pretty
yeah,
good. That's 2/3. So we're almost 70%, right? That's great news.
that is great news. So we can hopefully get to step 1 before June 14th.
Well, hopefully, but once again, we have to be very concerned about the hospitals and the numbers of people in the ICU and the number of patients they are still transferring out, right?
Yeah. Okay. When
And
are
the
you getting
number
your
of
second
COVID
shot?
cases. Me? Oh, I'm not getting mine till early August, the long
Really?
weekend, in fact. But I've got to take my mother in whenever they call her. She's 85 plus, so.
Yeah. Oh, you got the Pfizer.
Well, right.
Yeah.
Right, but true. But when my number was called, because I'm not as young as you think, we weren't offering it in the pharmacies here in Mississauga yet.
Yeah. So I'm definitely not getting the AZ. I'll get the Pfizer next.
Oh, what did you get the first time?
I got the AstraZeneca.
Yeah, so we're waiting for that research
Yeah.
data to come back on, the mixing of the vaccines. I used to call it the cocktails. So if you got AZ, do you get an mRNA next, right? To cover your
Yeah.
bases and give you more coverage, right? And you remember what dose 1 does? Lessens severity and hospitalizations and death. And dose 2 curbs the spread.
Agreed. I remember
Stops the spread.
I had Dr. Chakrabarty, infectious disease
Oh, good.
specialist, on November of 2020, and he
20?
said they're doing research on that back then. So it's not going to be new research. So there's still the research has been going on for a while. So
Good.
yeah, that's what he said. Okay, let's see what other questions I have. Oh yeah, have you seen in Toronto? The beaches was littered with garbage and stuff like that.
That's
Have
so
people in Mississauga
disrespectful.
been good people and clean up?
Yes,
Okay.
because, and I know they have. I walk the waterfront trail
Yeah.
all the time, and my security and bylaw would inform me immediately, and they would get out there and be cleaning it up. But I saw those reports on morning news all weekend long, and it was the community was out cleaning up public parks and the beaches because people were being very disrespectful. I mean, no matter when you go to the beach or go take your family on a picnic, or you don't leave your garbage behind, please. Who does that? Some of them left their chairs, their bottles, their garbage, their trash. Please take it with you if you're going to be on the beach with your family. It doesn't make any sense. I don't quite understand why people are leaving litter behind.
But people in Mississauga have been good. They've been picking up their litter.
People are very respectful in Mississauga, yes.
Awesome. Do you think schools will go back before June? That is the question I get the most.
Yeah. So the answer to that is that is now in the hands of the province and the unions, because the public health officers support it. We have taken a position that schools should be the first to open, the last to close. Last to close, first to open, put it the other way. Right, and so it's time for them to open. They feel it. The public health officers feel it is safe. They've written a letter to the premier saying, if you need our support, you have it to open schools. But I think that's now in the hands of the province, and they're in discussions with educators and the unions.
Okay. Based on the reopening plan, step 3 means that everything's pretty much open. So does this affect the plans of the city as far as events and stuff coming maybe in September and October?
So as I told you last week, we had to tell them no, because they have to make financial commitments, and I wouldn't want anyone to be out of pocket. So we said, if you're planning things for August, September, October, and you may have to make financial commitments, we highly suggest you don't make those. So let's just say we won't be having large events in the square at that time. Whether we will later. So for instance, let's look at whether there will be a Christmas market, a holiday market, or the tree lighting. Well, that might be a possibility. Maybe New Year's Eve.
Okay. Awesome. This question is from Utah, my son, and he just
Oh, how is he?
he's doing good. He's taller than me and has facial hair now. Super weird.
Scary. I always imagine him about, this big.
He's way taller than me now. He wants to know if one movie night is going to happen
Oh,
in
Utah.
October.
Right? I know. We'd have to paint those squares like they have in Trinity Bellwoods. I think
Okay.
they still have some trouble over there too at Trinity Bell. Too many people. But I understand. I mean, I can't condone it, but at the same time, I know that's an area that has very dense population with a lot of condominiums and a lot of young people that need to get outside, and that's the first available public park.
Okay. So I'll mark that down as a maybe. So you.
Okay. Yes, please.
Okay. Let's talk about cannabis.
Yeah, so that's very good. There is a report coming back to council on June 9th. Everyone
Okay.
circle their calendars. I know I've got tons and tons of calls, emails about it. It is not coming forward with a recommendation, just information. And you understand the reasons why we opted out, not opted in. It had a lot to do with zoning and control over where cannabis stores could locate. And we didn't want them near any sensitive use, which not only included schools, but community centers, daycares, drop-in centers, congregate settings, group homes, etc. We didn't want them close to sensitive use. And we wanted control over the number that would be permitted in any identified territory. So here we are in Streetsville or Port Credit or Lakeview, wherever we are, Clarkson, how many can open in a whatever defined area. And we weren't given the ability to control that. And so now we have observed the example in other municipalities, and quite frankly, I think it has gone quite well. I know there have been some examples. I think Councillor Parrish raised one about the St. Lawrence market area where a number of the small businesses or kiosks closed and the cannabis retailers went in, and how many can be allowed. And the reality is, the provincial government doesn't want to control that number. They want the market to decide. And we said, well, we'd be comfortable if, whatever number we decide is permitted, but not all. So, we have a dozen, for lease signs in open windows in shops and on Lakeshore. Can they all be cannabis stores, right?
Yeah.
So we wanted that control, and they have not given it to us. But we've looked at the example of other communities. I think Pickering just opted in. They had opted out as well. They opted in. But the other holdouts are largely, I think it's Vaughan and Markham and ourselves are the bigger ones that opted out. So it'll come to council on the 9th, and it's for discussion. There was a great report from the police board. From Peel Police did an analysis of the impact legal and illegal cannabis stores. And so Brampton has legal stores, and of course Mississauga has illegal stores, and that's just to say that they still operate illegally, right? And we're constantly trying to close those down. And what was found was there's greater criminal activity occurring generally in the cannabis stores where they are operating illegally. So there's something to be said for that too. And we all know that you can still order cannabis, online, and will be delivered to your home. So people are still purchasing it, and we have evidence that the industry is quite large here in Mississauga. We're just not permitting retailing. So this will be a discussion on council, and I think perhaps councillors will put a motion forward on whether or not to opt in or opt out, and it will depend on whether they're satisfied that, notwithstanding we weren't given the control over zoning that we had requested, that there had not been significant issues in other municipalities that did so, that proceeded with opting in. So I think that's the kind of discussion you'll be hearing on the 9th.
So, Mayor Crombie, if I ask, do you think we'll see legal cannabis stores in Mississauga by the end of the year, yes or no?
So that's all dependent on a vote of council, so I can't really speculate. I mean, I think there have been a number of votes that have switched, but is it enough? So you need 6 + 1, you need 7 people out of the 12 of us to vote yes to open. So, I can't tell you. I think there's a bit of movement, yes and no, on whether that will happen. So June 9th, Somebody may move a motion, and then it'll go to council the following week on the
Okay.
16th, and you'll know on the 16th, because it has to be a council vote, right? It's on June
Okay.
9th, it's a general committee where it will be discussed and then ratify. If there's a motion and if it's passed, then the bylaw will come on the council date a week later.
Oh, so
So,
it
stay tuned.
can be legal by June 16th if 7 people vote yes. Okay.
Correct. There is a possibility of that happening, but I don't know where the votes are right now. They've been a bit fluid, I'll say.
Okay. And it's been 1 year since the George Floyd murder. What has Mississauga done to fight anti-Black racism
So
and
it's
police
a
reform?
it's a great question, and in fact, I participated this morning. I'm just trying to get the name. The George Floyd Memorial Lecture Series. I was a speaker. The Path to Social Justice and Ethnic Reconciliation and Global Equity. That was sponsored by. It was a great institute. Let me just find the name. Center for. Ooh, hang on.
No worries.
What was the name of the, anyways, the group that put it on, oh, here it is, beg your pardon, Canadian Congress on Inclusive Diversity and Workplace Equity. So
Okay.
it was a great event. There had a number of politicians speaking on initiatives, and I had the opportunity to talk about what we've been doing. And of course, we passed the resolution last year that really addresses what we intend to do with actions to be taken on combating anti-Black and anti-Indigenous racism and discrimination in our city to make our city the most equitable and accessible for everyone. And I immediately created the Black Caucus Advisory Committee to me, and we've been holding consultation sessions, and we've now had two, and they've both been excellent. The first one was on empowering the Black community, and it was on political empowerment. And the second one was on accessing city resources. For instance, if there are cultural grants available, why aren't we having more Black cultural festivals, etc.? Other than in Black History Month, right? Because we have Carasaga and there's an opportunity there, but many other communities, and I'm Polish, so I always give that example. We have a Polish Cultural Day. We have a Ukrainian Cultural Day. We have Ital Fest, right, to celebrate Italian culture. So there are those opportunities. So there's a big take up on that one, and I was very pleased. But this Thursday, on the 27th, policing and social justice. And I know that one will be huge. And Justice Michael Tulloch will be participating. Deputy Chief Mark Andrews will be participating. And the chair of our police board, Ahmed Aktia, will be participating. And of course, I'll be hosting, and thousands of people will sign up. And I think it'll be one of the better ones. And so we have 6. These are the first 3, and then there are 3 more coming, and we'll wrap up at the end of June, and we'll have an action report, but with actionable items and recommendations that we will bring to council and then to regional council to be implemented. And so our consultation sessions are being hosted by a woman who is really good at this. She's a facilitator. Her name is Claudia McCoy, and she's created these consultation sessions along with my Black Caucus, my Black Advisory Caucus. And so I'm very pleased about that. And in addition to what I'm doing personally as mayor, the city has taken a lot of initiatives under Paul Mitchell as well. So the first thing he did was do a survey of kind of the cultural backgrounds, frankly, of our employees, because we've always thought that the employment at City Hall should reflect the community that we serve. And what we found out was that it does not. But it's a benchmark. So I'm glad we did it. I'm glad we know where we stand and where we need to go. So we'll be looking at our hiring practices and our recruitment practices. Does everybody know about these opportunities? And also training. Do people get the right training so that they can succeed? How do we facilitate their success? By providing greater coaching, mentoring, and training. And then just greater opportunities so that people can succeed, especially racialized communities, Black, Indigenous, people of color, BIPOC, and women as well. So we looked at the general population of our staff. We looked at the leadership team. We have a group called High Potentials, which are the ones kind of being, groomed for leadership positions in the future. And, what percentage of these are male, female, what percentage are Black, Indigenous, people of color, racialized groups, marginalized groups, people with accessibility issues even, right? So we're looking at that. So how do we overcome those barriers so that our staff can better reflect? Listen, I don't want you to get the idea that our staff aren't fantastic, because they are. We have incredible staff, and we know that because they stay. City of Mississauga is a great place to work. It's got a great culture, but it's not great for everyone, because we don't have enough people who are Black, Indigenous, or people of color, marginalized communities, racialized people working for us. And we know that. So how do we change that? And so what are the steps that we need to take? And that's all being addressed. So got to thank Paul Mitchum and Rob Trewartha works under him. And they've done a lot of this legwork, and that's fantastic. And they've also hired a new diversity inclusion commissioner, Asma Shakir. Sorry, I knew I got it. Uzma Shakir. I knew I was sort of getting her name. Uzma Shakir. And in also another individual in HR named Prabha Kaur, I believe. And so, these two people will really lead this initiative going forward along with HR. It'll be taken out of the hands of the city manager's office and out of Rob and Paul's hands and into Uzma and Prabha's hands.
Okay.
So I'm very proud of the work that we've done, and obviously it was a great day to discuss it because it's the anniversary of the killing of George Floyd. And I wanted to talk about the steps that we had taken in the 1 year. What have we done? Well, I think we've accomplished a lot. Do we have a lot to do? Yes, we do. But we're taking concrete steps and moving forward.
Well, Mayor Crombie, thank you so much. It is 5 o'clock. I'll catch you next week.
Thanks very much.
Okay, see you later. Bye.